COVID-19 healthcare tips naman yung pag-usapan natin. Of course, bago yan, patalastas ulit, rags to riches, 10% discount if you use Servings X R2R sa Things That Matter PH. So napakaganda po ng kanilang mga pillows. Ayan, makikita nyo. Ayan, okay. Sige, so patuloy natin. So, tingnan natin, no, ano ba yung mga sintomas ng ng COVID-19?
Ano yung mga sintomas ng COVID-19? Siyempre, yung alam na natin, ubo, sipon, fever. Dati people used to think it was loose bowel movement or yung pagtatae. Pero ngayon parang hindi na siya masyadong kina-consider. Yun, mostly yun, paghirap sa paghinga, difficulty of breathing. Yun, yung apat na yun.
Okay, so ito yung mga sintomas, no, natitignan natin pag COVID-19 yung pag-uusapan. Okay, so yung next natin na tignan, so kapag ako nakaramdam ng sintomas, ano yung dapat kong gawin? Dapat ba pumunta na ako sa emergency room agad ng ospital, or ano yung step by step para malaman ng mga nanonood sa atin?
Kung may ubo ka man, sipon, or fever, the first thing you should do is really contact your local doctor. So lahat naman po ng areas sana may naka-assign na doctor. Usually naman, meron silang hotline that you can contact. So number one thing you should do, alamin mo muna kung ano yung hotline ng area nyo, and then contact them if you ever experience any symptoms. Tapos sila na po yung magde-decide kung talaga bang kailangan na i-hospital or kaya naman siguro lang sa bahay i-treat, ganun po.
Okay. Sige, so yun yung procedures, no? Nung nag-imbestiga kasi kami, ito yung sa amin local health. So, ipaki-confirm naman kung tama. So, pag nagkaroon ng sintomas, yan, guys, ubo, hirap paghinga, at lagnat, no? Yun, una is stay at home daw muna. And then yun nga, call your municipal or provincial task force COVID-19. Tapos, yung health personnel na will bring patient or to the quarantine or isolation facility, or gaya nga ng sabi mo, Doc Amy, no, na baka pwede naman sa bahay. Okay. Ito lang yung mga pictures na pinadala sa akin sa areas, no. This is in Bonawan, I think this is Agusan del Sur. Ito yung isolation facility na itinalaga ng local government unit for this area. Tapos mayroon ding isolation facility. Ito naman ay sa Bislig City, o sa mas social yung sa Bislig City, yung kanilang isolation facilities. So at least nung nakita ko to, kasi hindi ko honestly, no, hindi ko ito nakikita sa social media and sa news. Ano yung mga local preparations na ginagawa for this. At saka hindi ko rin alam, baka naman, okay, may building lang dyan, tapos nilagyan lang ng tarp na isolation facility, yun na daw yun. Hindi ko alam kung ano yung what's really going on there. Pero sa inyo, ano yung mga ginawa ninyong preparation at ano yung nakikita ninyo na ginagawa dyan sa local government unit where you are assigned? So, Rap, si Doc Rap.
So, yung sa Tiboli, that's where I work, we have an interagency task force inside of our municipality. And then it's been a very good partnership with different stakeholders in the local government scene. Yung pag-coordinate po happens from the provincial level down to us sa LGU. Normally, we get information on incoming flights from our tourism officer or our DILG officer, who then informs the pickup team who's in charge of picking up the patient. So our objective po sa pag-pick up sa mga patients natin up to their isolation is dapat seamless po ang pag-quarantine, ang pag-isolate. So wala pong makakalabas na sarili-sarili lang po. Lahat po ng movements natin, napaka-coordinated po. Yung principle kasi na ginagawa natin is to make sure na hindi po makakalabas ang virus sa pag-isolate natin sa mga pasyente or repatriates or OFWs natin. one term po na ginamit po ng isang expert or infectious disease expert is leaky bucket. Ang ano na to ang pandemic na to kasi one small leak lang po, mas mahirap na po kasi ma-contain na po ang virus kung may just one patient na makalabas at makapasok sa barangay at makahawa po. Kaya napaka-importante po na at every step of the way isolated po siya. So yan po. So sa pag-pick up sa airport, dinadala namin sa municipal isolation unit namin. And then the intake interviews are done para malaman namin yung history niya, kung travel history, exposure, symptoms also. And then at which point we receive them and then we keep them inside of our municipal isolation unit while we are coordinating with the barangays to have them transferred to the barangay isolation facility. So may another level pa yon. At any point kung magkaroon po sila ng sintomas, gumagawa na po kami ng swab test. Luckily in our province, naka-develop na po ang provincial government ng sarili nilang COVID lab. Na-achieve na po namin yung ideal scenario of less than 24-hour turnaround time for laboratory testing. So we have our own PCR facility, which has been very important and crucial. At kaya po namin nalaman na mayroon kaming 3 na nag-react si Amy. Kaya po namin nalaman na meron po kaming 3 active cases of COVID. And then that's okay kasi with more knowledge, there's more ability to give the correct care. And then important din po yung ginagawa namin na counseling po. Katulad, very similar po siya sa HIV counseling kasi napakagrabe po ang effect, napakabigat po ng effect ng COVID status. I mean, 'di ba? May COVID status na, may yung COVID status ng isang pasyente para sa kanya. It's such a big effect on them because it's always on the news. And then grabe talaga yung mental health aspect dito. Pati yung pag-integrate po sa barangay. So napaka-importante yung yung cooperation and then yung participation po ng social workers and then the barangay captains. So yan po yung ginagawa po namin Ayaw po kasi namin yung may kumakalat na fake news or hinaharas yung pasyente, which has happened before, na may fake news na, hala, mapipick up ka na ng province, dadalhin ka na sa hospital. What? May ganon na nangyayari. Tapos yan, nahaharas yung pasyente. Oo. Kapag hindi po maganda yung coordination. So, but really, everything that we're doing has been a product po of the LGU innovating and adapting to all the surprises that that happened to us, all the surprise policies that have been happening to us. So we're doing our best. We're trying our hardest po.
Okay, so it's nice, no? Pero yun yung nakita ko on the, at least meron kayong testing facility, may isolation, pero sa treatment, yung inyong mga ventilators, oxygen, ganyan, facilities, kumusta?
At the level of, sa community level kasi, nasa amin lang po ang mga mild to moderate cases. We have purchased po additional medications. For example, if we have cases of secondary bacterial pneumonia, we have antibiotics ready. We also purchased additional oxygen just to prepare for in case we need to start treating patients. Pero yun nga, sa mild cases, wala naman po talagang treatment na kailangan Just supportive medication. Kung may fever, bigyan ng paracetamol. Kung inuubo, bigyan ng calamansi juice na may honey. Opo. Reassurance po. Kapag mild, parang trangkaso siya Pero kapag severe, severe to critical cases naman po, that's the realm of the higher facilities. So, may levels kasi. So yung sa higher facilities naman, patuloy po ang trabaho ng province po sa pag-capacitate po sa hospitals namin, sa pag-upgrade ng facilities. Ayun po, I can speak mostly for yung primary care level sa communities. But as far as I know, the province is working hard to increase yung
primary.
capacity
So may
namin sa
split pala yun, no? Yung inyo, primary, so yung split ninyo is primary healthcare that is a mild, asymptomatic up to moderate. And then dun sa severe and critical, yun na yung sa higher facilities. So kayo pala yung mga frontliners talaga, yung mga nauuna, no? At itong sabi lang ni Rosh, sabi niya, wala bang instant testing muna pag may symptoms na? So ano ba yung mga testing na mga ginagawa natin, no? Ito yung nakita namin when asked the local government, no? Ang tinanong namin, ano yung mga gagawin for COVID testing? So, una daw ay temperature check, tapos mayroong tinatawag na rapid antibody test, and then meron yung PCR test. So, ano yung pagkakaiba nitong dalawang test? Ito, Doc Amy. Okay, mukhang naka-freeze. So, muna ulit, Rap.
So yung sa let's say yung sa temperature check is screening that we do to check if someone has a fever, to check if they already are symptomatic. Doon po madedetect kung yan, hindi mo masasabi na COVID agad kapag may fever. That requires additional testing, which I will talk about, and then that's PCR. Okay. So unahin ko naman, isusunod ko na lang siguro yung rapid antibody test. Very controversial to ngayon kasi for some medical professionals or institutions or even workplaces, ginagamit na po ang rapid antibody test as the screening po. Because it's convenient, it's fast, it's what's available. It doesn't require a laboratory facility. Kailangan mo lang ng medical technologist to be able to conduct and a doctor to interpret the results. So dapat yun, it's like a pregnancy test, very easy to use siya and readily available. Pero the pitfall is it uses antibodies po. And antibodies are the defense that the body creates in reaction to an infection. However, there's a period in which a person might be positive with COVID but the body has not yet developed antibodies pa. Kumbaga, bago pa lang yung infection, hindi pa siya nakakagawa ng antibodies, which poses the risk of having what you call false negative. Ibig sabihin false negative na akala mo na negative, yung pala hindi. Okay? So yan yung risk. So it might give you a false sense of security kasi kung negative ka sa rapid test, you're saying, oh yeah, I'm negative, I don't have COVID, but that might not be the case nga. You might actually be positive pero wala ka pang antibodies for it. Which brings me to the gold standard of testing, which is the RT-PCR. Yung RT-PCR, it requires a high-level facility or high-level laboratory to run the test, which is why it's been a struggle kasi nationally to get laboratories ready to be able to do yung adequate testing using RT-PCR. That's what we do now sa province ng South Cotabato. Kapag meron na po kayo may mga symptomatic cases, tama po yung isang comment na nakita ko kanina, tama po yun, instant testing po yun. Kino-confirm na po namin or i-check na po namin agad kung meron na po siyang COVID. Ayan. However,
so yung nalalaman
the capacity is it's still scarce at our level. Yung sa level namin, our laboratory can only do so many tests. And then every day, alam ko na lumalapas na sila sa maximum ng capacity nila because they're working their hardest Ayun so it's still scarce. So mas kaya pinaprioritize namin talaga ang isolate first and then test later kasi we can't afford to test everyone. What we can afford is to isolate kasi that's the cheaper alternative. Yan yung feasible.
Okay. Tanong natin si Doc Amy, kung sa area niya ay mayroon na bang PCR testing ba yan? yung gold standard na sinasabi ni Doc Rap.
Actually, yun yung medyo nakakalungkot kasi if all the regions in the Philippines, nakita ko lang sa listahan kanina na pinublish ng DOH, Region
Aha.
13 or Caraga pa lang yung walang sariling testing laboratory. So actually for the past, since the start of the COVID pandemic, we've been sending out our samples to Davao kasi sila na yung pinakamalapit na testing
Mhm.
lab. So medyo kawawa din yung Davao on their part
Mhm.
kasi parang at that time, lahat ng samples in Mindanao were being sent there. So parang na-overwhelm talaga sila. Pero lately, buti naman,
Aha.
nagka-lab na yung kay Rap na province at Cotabato. And then sa
Mhm.
Cagayan de Oro recently, they na-approve na yung third na lab nila. So they already have 3 in the city alone. Unfortunately, sa Caraga, nasa zero pa kami. I know they're working on it, pero nasa zero pa kami. And we have been relying on those instant tests or rapid tests as
Right.
our main way of screening those na, yung tawag dyan, LSIs, locally stranded individuals, yung
Right.
mga pumapasok sa province namin. So, lahat ng, yung proseso namin, pag may, let's say, taga Higakit ka or taga Surigao del Norte ka, tapos na-stranded ka, let's say in Manila or in Cebu, you will first undergo a rapid antibody test sa mga ports of screening namin, like say sa pier or sa highway kung saan yung border ng Surigao del Norte. If it turns out negative, ika-quarantine ka. If it turns out positive, they will send you to the quarantine facility in the province to be swabbed. So based sa ganyang protocol, nakikita mo na not everybody is really entitled to a swab, although in an ideal world, yun yung mangyayari. But for us, we have been using the rapid tool as a screening tool or as a way to determine, to prioritize who to swab and who to not swab, given na wala kaming lab and medyo mahirap pa yung process of getting the test done because it has to go to Davao pa.
Right. Okay, so yung pinag-uusapan natin ay yung sa inyo is on the mild and asymptomatic to moderate. Okay, so tapos sabi ninyo pwede pala na at sa bahay lang iti-treat, no? So how does that happen? Ano yung mga healthcare tips natin kung nag-positive yung family member natin sa COVID? Tapos sabi ay, oy, puno na dito sa isolation room namin or sa quarantine. Sa bahay na yan. So, anong dapat namin gawin?
Well, we advise, so far pa naman, wala pa kaming nag-positive na kailangan sa bahay maka-quarantine. But kung meron man, we would advise pa rin na ideally, siya lang mag-isa sa bahay. Kasi yun yung important na wala siyang close contacts, especially yung mga matatanda, yung mga may maintenance medications, yung mga may high blood or diabetes, yung mga tawag na at-risk populations. As much as possible, siya lang mag-isa sa bahay. And then, lahat ng meals, ihahatid na lang sa kanya. So, sadly, bawal mo nang makikain sa ibang tao for that period of time na naka-quarantine siya. Kasi nga, quarantine. And
So,
then, walang bisita.
Iwan mo yung pagkain niya sa door. Tapos,
yeah, iwan yung pagkain sa
ganun
door.
yun.
And we always
Tapos,
advise, aalis na lang, oo, sadly. And we always advise,
paano yung paglalaban ng so, sino maglalaban ng for example?
What was that? Sorry.
Sorry. Kung kunwari yung sa care, no, yung laundry, sino yung gagawa nun? Siya ba mismo or ipapalaba niya sa ano? How do you do that? Mga practical yung iniisip ko kasi na mga tanong na pwedeng mangyari.
Yung person that should be assigned to deliver care, yung mga regular na yung pag-support sa patient natin, should be one person, first of all, one person lang. And then should be a person without comorbids, wala po siyang hypertension or diabetes, at dapat hindi po siya elderly. Kasi iniiwasan po natin yung magkahawaan or magkaroon ng severe pneumonia or severe COVID. Ayun po, limit contacts as much as possible. Tapos, yung sa laundry, dapat yan, mag-gloves ka, you make sure na, actually may specific list of instructions yun for laundry eh. Actually, I can share it with you later on. Gumawa din kami ng short pamphlet for it for our community here. So I can share it with you later.
Tapos ang tanong ko din ay kunwari, yung bahay kung nasaan siya, dapat ba ay nakasarado or yun yung mga kunwari, paano kung magkakatabi yung bahay namin tapos kailangan open yung bahay, di mahahawa ko yung nasa kabilang bahay or something.
This is an interesting question because for the longest time kasi yung thinking natin is COVID is infectious. Yung transmission niya is primarily through droplets. That means you have a radius of about 3 meters kung saan lumulutang ang virus until it reaches the ground, it lands on droplets. Pero ngayon may lumalabas na opinion among a growing body of science na airborne pala siya or lumulutang sa hangin ng ilang oras. Ano po yung importante dito? Kasi yung risk of infection po is dependent on the viral load. O, ibig sabihin nun, kung gano'ng kadaming viral particles yung malanghap mo or ma-receive mo through the air. The best way you can avoid airborne transmission is, yes, maintaining distance, but also increasing yung number of air exchange rate ng kwarto mo. Medyo complicated siya pakinggan, pero air exchange rate, yung ibig sabihin lang po yun, is yung pag-exchange ng hangin sa loob ng isang kwarto. So, the more air movement, the better po. So, open windows, open doors, best scenario po yun. So, open air po talaga para hindi po mag-accumulate ang virus sa loob ng isang kwarto. That said, importante din po na may barrier po between the rest of the household and then yung infectious patient. Kung maaari, iwasan po talaga yung contact dun sa patient, and then mabuti din po na ma-advise ang pasyente na magsuot po ng mask para maiwasan po talaga ang risk po na makahawa po siya.
Okay. So, yun, magmamask siya, tapos kailangan maganda yung ventilation sa kanya, no, sa bahay. Okay, so very practical yung mga nakukuha nating tips. Pero I think ang isa din na madalas na natatanong sa akin ay ito ano ba yung gamot na ibibigay kung sakaling sabihin na, okay, ititreat natin ikaw sa bahay kasi mild ka lang naman or moderate lang naman yung iyong sakit. So ano yung dapat ihanda namin? Mag-hoard na ba dapat kami ng malaria ano bang tawag doon sa gamot doon sa malaria pill na yan? So anong dapat namin gawin? Anong gamot yung paghahandaan?
Well, that's a tricky question. And I guess ako na yung sasagot kasi tapos na si Rap. Wala actually talagang gamot. Walang cure yung COVID-19. I mean, if there was a cure, di sana tapos na to lahat, di ba? Sadly, wala pang cure. Although there are some drugs na pinapa-research ngayon. But for those sa level, yung gamot na binibigay namin, depende sa symptoms yon. So, for a mild na cough, well, preference din na doktor. So, for me, as my preference, yung bibigyan ko usually mga lagundi, pinapainom ko lang ng water, ng madami. Actually, yung tuob, I do recommend tuob or yung steam inhalation para sa mga tao na may clogged nose, yung mga sakit ng sinuses, kasi nakakatulong yun sa pag-loosen up ng mucus. So yes, I would actually recommend that for sticky na mucus or parang mahirap na tinghutin na sipon. So ayun, lagundi, and for those na mukhang allergic yung reason ng cough, I would give cetirizine. Iba-iba talaga, kaya mahirap mo yung sagutin.
So kung ano yung sintomas niya, kunwari nilalagnat siya, di bigyan mong paracetamol. Ganun ba yun?
Paracetamol for the fever, yes.
O siya, di bigyan mong cough syrup. Ganun ba yun? Okay, sige. So fairly naman pala, no? Fairly straightforward siya. At yun, and I think gusto ko lang i-show to, no, si Claro Ordonez, sabi niya, prayers for all of you, docs. Oh, our frontliners din. Tapos may bumabati sa'yo, Doc Rap, hindi ko alam kung kilala mo si Alvin Chumacera. Hi, Dr. Ralph daw. Ayan. Anyway, so, ayun.
Rap, wrong spelling.
Ayun, tapos si Minda, sabi niya, ayun nga, so base on symptoms yung gamot. So mukhang alam naman, no? So at least naririnig natin ngayon na hindi naman pala death sentence yung pagkakaroon ng COVID, no? So ano yung chance of recovery kapag nagkaroon ka ng COVID-19?
Well, hindi ko pa nagawa yung math. I haven't done the math. Pero based sa current na data ng DOH, actually around 95 to 97 or 98% pa nga yung mga may sintomas. So the rest of the people, yung 2% na yun, yun lang sila yung talagang requiring hospital admission. But majority of COVID cases, mild lang talaga. I think nawala ako. Sorry.
Hindi. Si Rap yung nawala. Hindi si Amy. Ayan, okay. So yan yung chance of recovery natin. Ito lang yung mga figures natin for mukhang tayo muna, Amy, kasi nawala si Rap. So we have 38,000 active cases, 52,900 na yung natin, no, yung ating cases ngayon. So anong masasabi mo sa pagtaas na nangyayari? Are we moving towards the right direction given these figures coming from the DOH?
Honestly, that's a very tricky question to answer nga. Ika nga ni Rap, it's a very tricky question. Kasi on the one hand, yung pagtaas ng cases, it could mean that we're doing more tests or nag-increase nga yung testing capacity natin. But we wouldn't really know until, well, ako, hindi ko talaga masasabi until na makikita ko yung ilan ba talagang people yung nag-test per day. Ika nga ni Dr. Leland kahapon, yung positivity rate. We don't know really kung how many of those being tested per day actually do turn positive. So yun pa yung hindi ko pa na masyadong naaral. So based on the current data, it does seem like we're doing more tests. Wait, I think nawala ako.
America,
Hello?
you're good.
Okay.
Yeah.
But the good news is definitely we're seeing a decrease in the percentage of people who are dying. So at least kahit na tumataas man yung cases natin, less and less people are actually dying of COVID. So it could be that doctors and hospitals are getting better at treating COVID. That's the good news.
Yeah.
But another way to interpret it is baka din we're doing less tests on the severe patients. Tricky siya nga data, and it's very hard to draw conclusions from this alone kasi.
Actually, ito yung sinasabi mo, no? Kasi oo nga, nung konti pa yung cases natin, ang taas ng mga namamatay. At marami pa nga mga namamatay dyan, if I remember correctly, mga frontliners, mga doctors and nurses. Pero ngayon na mas mababa na yung ating yung ating mas mataas yung ating cases, pero mas mababa yung namamatay. So perhaps that's the explanation that you were giving. Pero dito, can you mention this one? Yung percentage ng symptomatic, mild, severe, critical. What does this all mean? Parang ako natatakot din kasi ako mag-comment because it may send a bad
message.
Ha? Nag-echo ko? Ayun. Ano yung chance na critical yung mapupuntahan ko kapag nagka-COVID ako?
Well, based dun sa nakita nating figure, around 2 to 3% yung nagiging severe and critical. It would be, siguro hindi pa ready mag-hazard ng guess na around 2% to 3% lang yung chance na ma-hospital ko. Parang it's too early to say.
Okay.
But it would be around that number if I were to have it.
Yung sa WHO, yung nakita nilang hatian is 40% mild, 40% moderate, 15% severe, 5% critical.
Okay.
So if you have COVID, you have a 5% chance of getting severe, yung critical, 15% of severe, tapos 40 evenly for mild and moderate. But again, this depends on your personal risk, which means if you yourself have an immunocompromised state, or if you have hypertension or diabetes, then you really are more at risk. Also, if you're elderly, So, yung disease na to, this could blow through the entire population naman, with leaving most of them, supposedly, as far as we know, given our very small limited data, most of them okay. Pero yung pinaprotect natin dito ay yung mga vulnerable, the elderly, the sick. So sila talaga yung at stake, at sila talaga yung pinaprotektahan natin by staying at home, maintaining our health protocols and safety protocols. Yun po.
Okay. Tapos itong next ay hospital beds and mechanical vents for COVID-19, and then temporary treatment and monitoring facilities. It's also figures coming from the DOH. So yung sa narinig ko sa inyo kanina, it seems like ang sitwasyon natin ay madami tayong facility for the mild, moderate, and asymptomatic. Pero pag dumating ng severe at critical, medyo dun magdedelikado. Tama ba yung ganong interpretation?
Tama yun. Kasi kapag severe or critical ka na, most likely sa ICU ka na papasok. And not every... Kulang yung ventilator capacity ng Philippines to service every potential na person who needs to be admitted. So if we assume na lahat ng may high blood, lahat ng diabetes, simba ko, mapupunta sa severe to critical COVID, even if they didn't get it at the same time, malamang kulang na kulang yung ventilator capacity natin.
Okay. So, sa mga probinsya ninyo, may mga ICU beds ba? Yung public hospitals?
We have 7 to 9 last I checked. Sa public hospital namin.
7 to 9 ICU beds?
Yes.
Okay, so kung kung 1% yung nagko-critical and severe, 1%, so 700 cases yung pwede tayo sa inyo, no? And 7 will be sa ICU. So yun yung, if we do the math, no? If I were to look at it, okay, so up to 700 buhay pa kayo. Pero more than that, delikado na. Sa inyo, Rap, ilan yung inyong ICU beds?
I'm not sure about the ICU beds that we have, but at the COVID facility, they can go up to 200 for the entire province na yun. And then, pero again, much less yung ventilator number namin, as in like very few.
Pwede ba mag-isip ko na lang tayo ng mechanical? Marami tayong manpower. Ganun lang natin.
Very few. Also to comment on yung community isolation space namin, we didn't, yung space namin was designed, well, it wasn't designed. Yung original purpose namin was to house those mild cases. Pero ngayon, ginagamit namin siya not just for mild cases, but also to quarantine all the new repats or the new OFWs, LSIs, stranded individuals that we have to take in all of a sudden. So much of it is used there. So ngayon, scarce na siya for the LSIs, and then scarce na siya for the mild cases that we have. And then for my municipality, so many OFWs kasi come from Tiboli. And then so many of them continue to trickle in. Napupuno na rin yung space namin, sad to say. And then with that, we need to make new space. So we need to constantly build new space and invest in that infrastructure because we
Right.
don't have a choice also. So
Oo.
adapt lang na naman yung LGU.
Oo. So actually yung naisip ko na parang okay, at the community level, very critical pala talaga din yung pag-aayos ng logistics for isolation kapag lalong-lalo na pag yung LGU isolation facilities ay napupuno na. So I guess ito yung takeaway ko for this interview sa microfinance program namin, yun yung gagawin ko na okay, pag puno na doon, yung mga magkakapit-bahay, pag may nag-positive dyan, o evacuate yung isang bahay, makitira muna kayo, ito yung gawin natin na bahay, isang bahay for the isolation. As a, a stopgap measure. Kung ubos na yung sa isolation facilities. Okay, sige. So actually, si Julie Rose, sabi niya, so more power daw to the doctors, to the virus, especially sa inyong dalawa. So marami nagpapasalamat.
Hi, ma'am.
Totoo.
Hi, ma'am.
Ang daya. Hi, mami.
Planted.
Okay, nanonood sila ngayon. Okay, so mabuti naman. Okay, so yun, ang dami talaga nating natutunan ngayon about this, and maski ako, there are questions on how how COVID-19 should be managed at the community level, at kayong dalawa nga talaga were very speaking from experience, yung pagbibigay ng examples at sagot kung paano i-manage at the community at the family level.
Thanks for watching! Kung may kapamilya, kaibigan o kakilala kang tingin mo ay magiging interesado dito sa video, please share to them or tag them in the comments section. Siyempre, kung nagustuhan mo ang video, pusuan mo na ito. Subscribe ka na rin. As always, feel free to write your questions, comments, and opinions respectfully.